Our target is to reach about 500.
Non-communicable diseases, also known as chronic diseases, are illnesses that are not spread from one person to another, and these include conditions like cardiovascular diseases, cancers, chronic respiratory diseases, and diabetes. According to the World Health Organization, these are responsible for at least 43 million deaths globally each year, accounting for 75% of non-pandemic related diseases, with about 18 million of these deaths occurring in people under 70 and 82% of these premature deaths happening in low and middle income countries. In Uganda, approximately 35% of all deaths are estimated to be caused by non-communicable diseases, implying that around one-third of all deaths in Uganda are linked to conditions of heart disease, stroke, cancer, and diabetes, worrying the health experts in the country.
According to the evidence that we have, out of 100 people who die in Uganda, about 35 die as a result of non-communicable diseases. So it's a very big problem. And it affects people who are in their prime ages, at least age 30 to 70 years. These are people who are most productive, and they're very important in driving the economy in this country. The lifetime risk of dying prematurely from the non-communicable diseases in this country is about 22%.
Dr. Charles Oyo, the Commissioner on Non-Communicable Diseases in the Ministry of Health, explained how the ministry is aware of the double burden of high cases on non-communicable diseases, contributing to a significant number of people dying in the country.
We are aware that as a country, we are faced with a double burden of high number of cases of non-communicable diseases like hypertension, diabetes, stroke, heart failure, cancers, chronic respiratory diseases, sickle cell disease, injuries, and others.
According to Dr. Charles, there are several risk factors related to non-communicable diseases, including the high consumption of alcohol, tobacco use, unhealthy foods, and other factors, as he explained.
The risk factors of NCDs are mainly high consumption of alcohol, use of tobacco and tobacco-related products, unhealthy foods. These are foods that are very high in salt, high in sugar content, high in bad fats, so the saturated fats, low in vegetables, and low in fruits. These are some of the common things that we know they are very prevalent in this country.
What can be done to address the high cases of non-communicable diseases in the country? James Mwesgwa from the Uganda Protestant Medical Bureau explained a number of solutions to the problem, indicating how much work has been done so far, including screening of over 10,000 people in the country.
10,000 that has been screened over the 2 years of this program, and we have managed to retain a big number of those patients now under care in hospitals, being looked after trained health care professionals.
Addressing in Kampala, Atwiine, the Permanent Secretary for the Ministry of Health, recounted the number of patients with non-communicable diseases and called for collaborative efforts among the different stakeholders. She echoed the government's commitment to addressing the challenge.
We really need to have a very, very clear strategy on prevention. That one, whatever we are doing even at our facilities to treat, it is very important that we do a lot of prevention interventions. I am happy that we are having the tool to map all our partners in NCDs.
Dr. Charles called for the integration of all the NCD services as the remedy to the problem in the country.
Integration is the way to go. We have to integrate all our activities, all our plans, all our services, and look at the patient as a whole. So if a patient presents before you, you take care of that, the needs of the patient holistically. In one clinic, by the same service provider, and you do the comprehensive investigation and the care that is required of that patient.
Definitely we need integration. Integration of non-communicable diseases and infectious diseases is very important, and HIV, TB have been very good roadmarks because they are chronic diseases, and they've shown very good examples of how non-communicable diseases can be integrated into communicable diseases. What has not been done is the integration of infections in non-communicable diseases.
John Baptista Homza, Church of Uganda Family TV News at 8.